This video is meant for information purpose only. It is not intended as a substitute for medical advice. You should consult your surgeon about your specific condition. Diabetes can cause serious foot problems that can result in infection, deformities and sores. People with diabetes complications may also experience gangrene, which causes tissue death and may lead to amputation of the toe, foot, or part of the leg. Dr. Ashok Pandey, a plastic surgeon, strives to avoid amputation and save the limbs of a diabetic foot patient by using soft tissue reconstruction method. What is diabetic foot ulcer? Diabetic foot ulcer is an open sore, or wound on the foot of a diabetic person. Mostly, it is located on the bottom of the foot, also called as plantar surface. Now, let us understand foot problems in diabetic patients. Diabetes affects the foot in three main ways. Increases infection. Due to uncontrolled sugar level in people with diabetes, a small infection may turn into a big wound, or ulcer. Diabetic peripheral neuropathy. Diabetes can cause nerve damage, also called as peripheral neuropathy. Diabetic people may experience some form of neuropathy, such as tingling, numbness, or burning heaviness in the feet. Vasculopathy. Diabetes also damages blood vessels by causing inflammation and atherosclerosis, or hardening of the arteries. When poor circulation affects the arteries of the feet and hands, it is called peripheral artery disease. The blood supply to the foot decreases to such a bad extent that healing does not take place. What are the symptoms of diabetes-related neuropathy? Symptoms of diabetes-related neuropathy includes any change in foot shape, darkened skin on the affected area, including wound or redness, loss of feeling in the toes, feet, or legs, pain, tingling, burning, or cramping in the feet or legs, thick, yellow toenails. What are the main surgical treatments available for diabetic foot disease? Surgical treatments. Debridement. Debridement is a procedure used to clear out dead or infected skin and tissue from a foot ulcer. It allows your surgeon to access the extent of the soft tissue damage and encourage healing. Great care is taken to clear the wounds during the surgery. Achilles tendon lengthening. In some people, the Achilles tendon may pull or put pressure on bones, causing ulcer to form. During an Achilles tendon lengthening surgery, the surgeon stretches and cuts the tendon and thereby release the tension of the tendon, which brings relief to the patient. Vascular surgery. People with diabetes tend to develop peripheral vascular disease, which prevents a foot ulcer from fully healing. Hence, a vascular surgeon may perform one or more procedures to increase blood flow, such as endovascular surgery to keep blood vessels open, arterial bypass to restore blood flow to the affected area, reconstruction surgery. Diabetes complications may lead to severely infected ulcers that do not get better with treatment. A plastic surgeon has the capability to enhance healing by soft tissue manipulation, followed by a reconstruction algorithm to manage and salvage diabetic foot ulcers. Dr. Ashok Pandey is a senior consultant plastic surgeon and director of Mumbai Cosmetic clinics. He specializes in plastic, reconstructive, maxillofacial, hand, burn, microvascular diabetic foot, laser and cosmetic surgery of face, nose, breast and body. He has an experience of 15 years, and has successfully completed more than 10,000 cases of plastic surgery. Dr. Ashok Pandey is also the founder of Institute of Cosmetology and Aesthetic Medicine, Mumbai. The institute offers cosmetic surgery master courses, postgraduate diploma courses in cosmetology, clinical cosmetology fellow courses, for doctors under one roof. Dr. Ashok Pandey also conducts diabetic foot camps. In one of Dr. Pandey's published article, he points out that a diabetic patient should not ignore lasting numbness, shiny skin, redness, or swelling of feet or leg, any injury, wound, ulcer or corns, including foul smell discharge. He further says that prevention is better than cure. One can reduce their risk of developing diabetes ulcers by following appropriate evidence-based prevention and management protocol. Dr. Pandey has been one of the expert faculty member for conducting masterclass on pressure injury prevention and management. Dr. Pandey has received a token of appreciation for his contribution as a faculty member relating to wound care days for transforming patient outcomes.
دكتور 100% دكتور أولينا دكتور أمراض السكر جميع الأمراض لنا 100%.
نحمد الله جينا من شرورة على
عربية
شوف اليوم كيف غرغرين 100%.
كيف دكتور؟
دكتور 100%. والله أنا أجي من شرورة عشان هو دكتور هذا.
كيف هذا قنغرين عليه؟
غرغرين الحين يجي 100%. أول لحم أسود الحين لحم 100 نظيف ما في ريحة ما في كل شيء.
كيف دكتور إن شاء الله؟
دكتور 100%.
كيف أبو دكتور؟
دكتور 100%.
الحمد لله.
Okay, thank you.
Dr. Pandey presented few interesting diabetic foot and trauma cases at 2nd MD APIC Symposium, Kuala Lumpur, Malaysia. He also shared Indian experience. Dr. Pandey emphasized the importance of dermal regeneration matrix for complex wound reconstruction. Dr. Pandey helps patients to get perfect treatment and precaution for diabetic foot. For more specific advice about your diabetic foot, you can contact Dr. Ashok Pandey at his consulting chamber at the below mentioned address. To schedule appointments for consultations and surgical procedures, please call 9930-731-109 or 2780-1101. Email your queries to bombaycosmeticlinics@gmail.com or visit www.bombaycosmeticlinics.com.